Hello, it's Dr. Rhonda Johnson. Today is Wednesday, January 18th, 2023. Today I am talking about pregnancy outcomes from COVID infection and mothers and babies. Well, I'm sharing some results from an article published on January 16th in the British Medical Journal, Global Health Journal. This was a scientific meta-analysis, or in plain language, review of 12 studies from 12 countries involving over 13,000 pregnancies. And the findings were quite striking. Now, I do want to say they did not differentiate the various COVID variants. Now, pregnant women were 7 times more likely to die, 4 times more likely to require ICU care, 15 times more likely to be on a ventilator, 23 times more likely to have pneumonia, 5 times more likely to have blood clots. And the study looked at the outcomes of babies born to moms who had COVID, and they found they were nearly twice as likely to be admitted to the neonatal intensive care unit, 3 times more likely to be born at 34 weeks or earlier, and 19% more likely to be underweight at birth. So these researchers from all over the world concluded that COVID infection at any time during pregnancy increases the risk of severe maternal morbidities, neonatal morbidities, that's complications, death of the mother, but not stillbirth, meaning the babies are born when they're no longer, they're born dead, basically, or intrauterine growth restriction. Now, this study mirrors numerous studies that were done in the United States looking at maternal and birth outcomes in women with COVID infection since the pandemic began in 2020. And they have shown consistently an increased risk of preterm birth, an increased risk of ICU admission in the mother, and neonatal intensive care admission in the babies, as well as an increased risk of complications such as high blood pressure, preeclampsia, and blood clotting. So the studies mirror each other in terms of their results. So what should a pregnant person do? Pregnant people should take extra precautions to lower their risk of getting COVID. That includes masking, indoors, avoiding high-risk indoor settings, maximizing ventilation and air filtration, hand washing, wearing a high-quality mask, and the American College of Obstetrics and Gynecology strongly recommends COVID vaccination if you are pregnant, breastfeeding, or planning to get pregnant. So folks, if you know someone that is pregnant or planning to get pregnant, please share this video. Thank you so much. Be careful, folks, and take care.